Good afternoon, everyone, and welcome to our two of a series of two webinars on our I2P2 program, otherwise known as the Industry Innovation and Partnership Program. Thanks for taking some of your lunchtime to be with us and to learn more about the program. My name is Simon Cheeseman, and I'm the business lead of CC ABHI's Innovation Office, and I'll be reviewing some of the program details with you, as well as taking some time to answer your questions. So let's just get into it. This is what we're going to cover over the next hour or so. So we'll take a moment to introduce ourselves as CC ABHI. What are we about? What do we do? We'll move on to the program itself. So what is I2P2? Who is it for? Who can apply? Who can't? What kinds of projects is it meant to assist with? And then we'll get into the details of how to apply and the process through which the application will be reviewed and selected, and some of the key dates that apply to that process. And then, as I said, we'll take some time for questions. Be aware that there is a chat window probably on the right hand of your screen in the webinar toolbar there. Feel free to enter your questions as they occur to you into the chat window, and my colleagues are monitoring that window. They may respond in real time if it's an answer they can get to right away, and they may also hold it aside to the end of the presentation where we'll cover it in person on the webinar here. So let's start at the beginning. Who is CC ABHI? What is CC ABHI? What are we about? So the Canadian Centre for Aging and Brain Health Innovation is a solution accelerator, which means that we are here to speed up the process by which solutions are developed and adopted into the healthcare system that address some of the key priorities in the aging and brain health sector. We do this, one of the primary mechanisms by which we make this happen is these programs, the kind of program you're learning about today, like I2P2. About a month or two ago, we launched our Spark program, which was the first of our programs. It was aimed at point-of-care innovators who are taking their insights at the bedside of the patient and starting to build early-stage solutions and to move them on to a point that they could be tested and evaluated within an operational setting. This program, I2P2, is aimed at industry innovators, and of course we'll be speaking about that for the rest of the presentation, but we have additional programs in the pipeline coming out. One will be aimed at the innovations stemming from clinician-researcher collaborations, and then later in the year we'll have a program aimed at knowledge mobilization and change management, assisting with the adoption of innovation. And those are all very exciting, and you should keep your eyes peeled, especially if you, at the end of this webinar, you realize that this program isn't quite tailored to your solution. There are more coming, and those programs will also repeat year over year and evolve. So please stay with us. But today we're talking about I2P2. So let's get into that in more detail. So what is the purpose of the Industry Innovation Partnership Program? That's the two I's and the two P's, and that's why we call it I2P2. It does not infringe on the Star Wars copyright, so don't go down that path. The I2P2 program is there to address a very important chasm that commercial innovators face as they develop their new products and services, getting it into the healthcare system. So this program is there to address the gap that exists between commercial innovators and their new products, sometimes very innovative products that will turn a problem on its head and solve it in a way nobody was expecting. And then on the other side of that gap, you have healthcare organizations who are looking for new solutions that will address problems that they're dealing with and address priorities that they need to address. And the gap between the two is notoriously difficult to fill. You have time and resource-strapped organizations who are looking at the innovations that are new to the market or not yet in the market and asking themselves if they can take those precious resources to seek to adopt them into their organization And then to make that decision, they need proof and evidence that that solution will be effective. And you have the commercial innovators on the other side with limited testing and um, evidence from smaller scale tests, and they need to reach out to a real larger scale operator to test their solution out, and the two and there's that missing piece in the middle that will allow one to take the step with the other. The Industry Innovation Program tries to address that problem by providing matching funds to support projects that will allow for the testing and evaluation of these solutions in a real operational environment. So the idea is that up to $600,000 per project can be matched with funds contributed by an industry partner who can contribute cash and in-kind resources to the project to combine into a significant trial effort. Those resources will go to the trial partner to spend on trial and project-related costs. And that will allow all the parties to come together. So not only will you have a project, the product of which will be experience and connections with a trial partner site, but you will also have evidence from a robust and objective evaluation framework that provides reliable and objective evidence to your product claims. Not only is CC ABHI bringing the matching funds to this project, but we are also providing a brokering kind of service for the shortlisted projects, for the shortlisted applicants. So you can come to this project with a trial partner in hand, or if not, then that is something that CC ABHI can provide you once you reach that shortlisted stage, that we can do the brokering and connection with some of the leading healthcare organizations across North America. So that is also an important enabling service that comes through this program. We'll be providing up to $1.5 million in this call across all the projects, and as I say, up to $600,000 per individual project. So let's get into some of the fine print. We'll take this in layers. So who can apply? This program is aimed at commercial innovators. Innovative products and services can come from a lot of sources. This program is targeting companies of all shapes and sizes from all over the world with that are operating in the private sector and are looking to take a product that is almost at the commercialization stage or just recently entered into the market to apply and be matched up to do their trial and evaluation with this program. People who are not eligible, people and organizations not eligible, are not-for-profit and charitable organizations, publicly funded agencies and their departments, individuals who are not yet in a business or a corporation, and also incubators and investment funds. People investing in companies with innovative products are not eligible to apply. Researchers, academics, and clinicians affiliated with health service providers or educational organizations, you're not eligible to be the applicants with this this trial. Healthcare service providers may be a trial partner site if a commercial company reaches out to apply together, but the company needs to be the main applicant and you would be the trial partner site. And as for researchers and academics and clinicians with their own innovative solutions, you may want to keep your eyes open for the program I was just speaking about at the beginning, which will be coming in a month or so, that will be aimed at you to be named. That's who can apply or what can apply. What sort of projects would qualify? So just to be clear, what we're looking for are products that are ready for use, that they are either advanced prototypes or recently or ready for market products. And of course we're looking to support non-invasive medical devices and other emerging technologies that are being applied to a healthcare setting, whether it be robotics or virtual reality or digital solutions of various kinds using mobile devices, cloud computing, you name it, those kinds of emerging technologies and opportunities aimed at the wellness and digital health marketplace. But we're also looking at delivery practice, therapeutic technique and approaches, and also educational interventions or products and services that may also be providing value that you would like to evaluate. Now, of course, those last three may also be enhanced by digital solutions and other technologies, but we wanted to make the point that it doesn't just have to be a widget or something with a USB port. It can also be these more process-oriented services that would be eligible as well. What's not eligible are drugs or pharmaceuticals, surgical or other invasive medical devices, and then more along the lines of the point of the program, we're not looking to fund basic research or research that would be primarily academic in nature. The main deliverables would be papers and things that would go on an academic CV. We're looking for projects that are readily transferable to a point-of-care application. You see another ineligibility criteria there that speaks to the four themes that we've identified this year as our priorities. I'm going to move to what those themes are right now. So another key thing to keep in mind is that CC ABHI is targeted 4 priority areas for its projects this year. These are sort of the problem sets or the topics that we have chosen as being our focus for this year, the challenges that we want addressed in the aging and brain health sector. And they include emergency department visits, reducing them, avoiding that which can be avoided, especially for older adults living with dementia. How do we keep them healthy at home and away from the emergency department? Falls prevention, so reducing the number of falls or mitigating the injury due to falls, and especially solutions that target or help people, again, suffering with dementia or cognitive impairment that may make them more resistant to other solutions or that might specifically address problems that they face due to falls. Aging at home, again, the ability to age at place safely and with greater quality of life is the focus here, especially for older adults managing multiple chronic diseases and especially including cognitive impairment and again issues that might affect people with dementia. And then finally, cognitive fitness. This category isn't necessarily aimed at people already suffering from dementia, but that targets, extending or increasing the capacity around the aging brain and avoiding some of the more damaging outcomes from might stave off developing a cognitive impairment. We've talked a little bit about these projects and products being at an advanced stage of development, so I'd like to clarify what that means. An advanced stage of development means that the principles or concepts behind the solution have been well established and well proven and have been incorporated into your product, that the validation of the product itself has been achieved either on a small scale perhaps, or in a simulated environment, or perhaps even in a foreign environment. Perhaps it's in use in another country or another jurisdiction, but has not yet been tested here in North America or in Canada specifically. And there's some unique challenges that you would like to prove that it can tackle in this context. And then also, as I mentioned before, that the prototype or the commercial product is ready for demonstration and is robust enough to be tested in an operational environment with real patients and real doctors and real clinicians of various kinds. So that's the I2P2 in a nutshell. Now I'm going to move on to the topic of actually applying to the application. So I'm going to take this in two parts. The first one is the actual expression of interest. Now this is coming up soon, so if this is the first you've heard about the program, you have a tight deadline ahead of you. It's due by November 23rd, which is this coming Monday. It's not insurmountable if this is the first time you've heard of it. So I'm going to go through the expression of interest form online and show you a little bit about how to submit it and what is in that form. And then from there, I'll move on to the larger process that you're entering into with the I2P2 program. And again, I'm going to highlight some of the key dates affecting that process. So I'm going to jump out of this PowerPoint now and show you exactly how to get to the application form. So now we're talking about the expression of interest. So the best way to find it is to just go to our website. That's ccabhi.com. Okay. The best way to find it is to click on this giant blue button at the top of the page. So if you click on this, you'll go to the page with all the information you need about the I2P2 program. There is another way to get there, just to quickly show you. So projects, innovation opportunities will take you to a landing page. From there you'll find information about the Spark program and the I2P2. But for directness reasons, I will jump straight to the I2P2 page. So you can see here, so the first step is please take a look at this information. So I'm covering a lot of it in this webinar, but please do have a look so you really see all the information about the program, who it's aimed at, and those key dates. And there's a list of frequently asked questions at the bottom of this page. This part of the document is sort of a living part of the web page, and we'll be updating it with more information as we receive good questions and put it onto the FAQ. So, but how do you get to the expression of interest form? So there's a link down at the bottom of the page that says Apply Now. There's also one right up here at the top, Apply Now. So if I click that, it takes me over to the form itself. I can see I was testing the form earlier. Okay, so this is the form. It's an online form. It saves your information as you go. So you can actually work in this form as opposed to working in a Word document and cutting and pasting in later. To save your work, you don't need to create a user account or log in to access your own personal version of the form. When you go to the form on your computer, it will save information in a cookie in your browser, as well as create a unique URL that you can use to access your form again. And I'll just show that very quickly. So I'll just start typing in some fake information here. Test application, test. Okay, so that's the project title. So now I have to go to a meeting and I can't keep working on this form, so I'm just going to save my progress. It saved the form. So now you can click here to email yourself that unique URL that I talked about, and then you click on the little paper airplane and it will send it to you. Or if you'd like, you can just bookmark this very page you're on. So in this case, you would just be bookmarking it like here in Chrome, but if you're in another browser, there's other ways to add bookmarks. You see this long string of text at the back of your URL. That's what makes it yours. So every time you go to that URL, you'll see the data as it's been saved in your form. There is an advantage to saving it in this way, is that if you are working with a colleague, you can take that URL and you can forward it to them, and they can continue to work on the section of the form that they're going to work on. Just one word of caution on that is try not to have this form open in 17 different browsers at the same time, or to have it open on your computer in 2 different browsers or 2 different tabs. Maybe this is just an artifact of me testing the form constantly, but if you do have it open in a few places, I find that you can get yourself into trouble overwriting data, which is understandable. Okay, so now I'm going to go into the details of the form itself. So you already saw that we asked for a project title, and the form is really just broken up into 3 very intuitive sections. The first one is asking for information about you. So who is the company? Now, as I said before, the company that should be applying is the commercial entity with the innovation to be trialed. So capture that your company's name here, website, your own name, all your contact information, and then there's 2 additional pieces of information we ask for. So what is your role in the project? So when you've put yourself as the main contact, what is it that you're doing? Are you leading the project? Are you administering the project? Are you just a contact person, or are you the substantive leader of the project? and then information about your organization. Tell us more about your organization's background and experience, what it does. You can provide a URL here to more information, or you can attach a brochure or some additional information about your organization there. You can also, here's where you can apply with a trial partner. So if you already have a trial partner site identified, and you don't need to do that, but if you do have a trial partner site, you would indicate yes. There's some rules about who can be a trial partner site. In short, it's basically, it should be a healthcare organization in Canada or taken from one of CC ABHI's network partners in the States. If your trial partner is in the United States, be aware that it is a requirement of the project that at least one of you be in Canada. So if you're the innovator in Canada, you can have a US trial partner. If you are an American or international commercial entity, at least one of your trial partners, and you can have more than one, although things get complicated quickly, but at least one of your trial partners needs to be in Canada. So we need a Canadian partner in the project. And here you of course are capturing all your information about your trial partner site, and if you have additional trial partner sites, you can keep adding them. The next section of this document is the product or solution description. Here's where you're essentially telling us about your product or service or solution, and of course you'll identify it by name. You'll describe what kind of solution it is, what problem it tackles. So this is your opportunity to align it with one of our 4 themes. Whether it be ER avoidance, falls reduction, aging in place, cognitive health. Tell us how it maps to one or more of those things here. Then you get to give us a more flowing narrative about your solution, what it does, who it's for, what are the key customers, and what does it provide to them. Where are you in terms of development? And aside from choosing one of these categories, prototype, fully developed product, you can also give us more information about where you're at in terms of your development. After telling us about your product or solution, you'll tell us about the project. So ultimately, these dollars will be spent on a project to evaluate and otherwise support your product or service. Give us a description of that project here. So what would you be doing? What are the goals? How does it align to your product and the solution and the claims it makes? What are some of the targets that you'll be aiming for and accomplishing? And then aside from that that prose description, you are also asked to give us a brief project plan and budget. So we've provided a template that we do request that you use to capture that information. So we've tried to keep it very simple. The link to that template is here in the category itself. You'll download it as a Word document, and then once you've completed that document, you'll be attaching it to the form here. One thing to keep in mind, and I sort of described that as I was describing the process of brokering. So you will create a project plan and a budget, but if you are being brokered with one of our trial partner sites, with a trial partner site we identify, there is a period where we'll be finalizing the project scope, timelines, goals, budget, etc., based on the capacities and desires of the trial partner site, because that will be a working partnership between both of you. So this is a starting place to give us a sense of the scope and the funds being made available for the project and required. Do you have funding from other sources? If yes, tell us. The final section here is about your team. So that's, of course, obviously an important aspect to indicate to us your capacity to successfully pull off the trial you're describing. So give us your core team members. You can have as many as you consider core. You can identify here. For each one, we ask that you provide us their name and title, attach a CV or resume, and then in the section provided here, give us a narrative on everybody's role and purpose on the project. And then finally, if you have some additional information to provide either about your product or the company or the people or anything relevant that you would feel like you need to share, you have the ability to attach a few more documents here. If you have even more that outstrip this form's ability to attach documents, just contact our tech support folks. That'll be either me or my colleague. and we will work with you to attach additional information to the form by you sending it to us. It's not a problem. There's a lot of basically all the forms are mandatory. Once you've completed them, you'll be able to submit your document, and we will receive it on our end, and we will begin the rest of the process. Speaking of which, so I segue back to the rest of our presentation. So that was our tour of the expression of interest form. Now I'm going to talk about the rest of the process and the dates associated with that. So as we were just describing, your expression of interest is due on the 23rd of November. That's 8 days from now, the coming Monday. Between that time and no later than December 12th, we will evaluate and select the people we will select those people who will ask to provide a full application. The full application is available online on that long page about I2P2. You can look at the full application. It's provided to you in a read-only form, so that if you want to get going on it, you can do that right away as you're doing the expression of interest or right after. But on December 12th, we will reach back to you if you're a successful applicant and ask you to complete that full application, which is similar to the expression of interest but goes a little deeper in terms of detail and asks a few additional questions. That in turn is due on December 23rd. Between December 23rd and January 26th, we will be going through a shortlisting process. So we will be reading and evaluating your full applications. We reserve the right to reach back out to you at this point to clarify and revise elements of your project if we feel that's necessary. And by the end of January, around January 26th, the shortlisted applicants will be notified. It's only these applicants who will be entered into the brokering process. So starting at around the end of January, we will be completing and finalizing project scope and outcomes and budget and timeline, especially for those people who are being brokered with a healthcare organization to be a trial partner site. So over that time, we'll be making meetings and creating partnerships and finalizing the aspects of the project. It's that finalized version of your project that will go to our project selection panel and selected to receive funding, and that will conclude at the end of May. And from there, it's a matter of signing legal agreements between all the parties in the project and to flow the dollars to start these projects in the summer of 2017. We're aiming for July. So that's the process. Expression of interest, invited to apply. Full applications are shortlisted. Shortlisted vendors will be teamed up with trial partner sites. The final projects from that brokering process will be selected for funding. A subset of those projects will be selected for funding. Up to $1.5 million in funding available in this call. So just to clarify the roles between our two groups here. So as CC ABHI, obviously we're here to identify and broker trial partner sites, including, and this is important, working to establish who the champions at those sites will be and who the specific project resources and leads will be. So you'll have a firm partner on the other side of your fence. We will be assisting you with pilot and research design and the post-trial evaluation process. So we'll be fleshing out that project with you, ensuring that it meets all the parties' needs, including our own. We'll be monitoring the implementation of your project to harvest, key indicators that are important to us to ensure the project is having the impact that we want it to, as well as just general project milestones that will be tied to the payments to make sure that we're moving along as agreed upon. And of course, we'll be assisting you with bragging about the great outcomes from the project. So we'll be talking about the findings, talking about progress made, and assisting you in the communications aspect of that. On your side, as the vendor, of course, you're going to partner with us and the trial partner site to define and implement a project that is agreeable to all parties. You will be providing matching funds, both cash and in kind, so you'll be allocating that committed project resources throughout the trial. And this is important as well to call out, is that there is a 10% administrative fee that is paid to CC ABHI on top of the budget of the project. So that 10% is based on the total project budget and is paid to us to cover costs for overseeing the program. And then finally, you will be working with your trial partner site to report to CC ABHI on the progress of the project, which is important for us as a funding body. So we've talked about who can apply and what kind of projects can qualify. We've talked about the 4 themes that it should align with, 1 or more of the 4 themes. And then these last sets of criteria is how all the elements of your project will be scored. Apologies for that. So just to quickly review, so your expression of interest in your full application, this is the criteria against which they will be held. How well does it align with those 4 themes I just discussed, the goals and intended audience of the program? Does it provide strategic value to the organization using your product? How well does it address specific needs? Are those needs measurable, compelling, widespread, both on the clinician side and on the patient side? How feasible is the project? How well planned? How well resourced? How realistic, both from a technical and a clinical perspective? How immediately scalable is the project at the end of the pilot? Is this something that can pivot and go broad? Is this something that needs to be retooled? Is it only applicable to a small aspect of the marketplace, or is it broadly applicable? Your team, what kind of experience do they have that demonstrates their ability to successfully conclude the project, and what kind of track record have you had with aging and brain health products and healthcare products in the past? How innovative? That's a bit of a slippery concept, but what we mean by innovative is how groundbreaking, how unique is the value proposition, how hard is it to copy, and how unprecedented is it? What kind of results would we expect to receive? Incremental ones, or will there be some kind of a breakthrough if this is a successful project? And then finally, KPIs. I've already made mention of that. How measurable, how likely is it that we'll get strong measurable impacts within the organization where the trial is ongoing in terms of patient experience, quality of life, and economic benefits, both to at the enterprise level and beyond. So that's your whirlwind tour of aspects of the program. It's a lot to absorb. As I said, all that information is available online as well, and we're available for additional questions right now. So if you haven't already and you have some questions, you can enter them into the webinar chat box. If you feel like you would rather handle that by email, that's okay. You can do that too. I have a few questions here from the last time we did the webinar, and I'm just going to cover them first. Okay, I already have a few questions, thanks. And then I'm going to cover these ones that we had prepared in advance. So the first one was we heard from healthcare providers or healthcare service providers who were on the call yesterday, just wondering how they can make themselves available to be considered for the brokering process. So we're very clear here how commercial innovators can apply for this, and of course they can reach out for trial partners. But how would a trial partner, potential trial partner, become one? I think the easiest thing for you to do is to reach out to us directly, let us know who you are and that you're interested in being considered when that brokering process begins towards the end of January there, when we reach that stage of the process. Just let us know who you are and that you'd like that to happen, and who we should work with on your side, and we'll reach out to provide more information to you and to gather more information. We also had a question yesterday about intellectual property and how what about intellectual property that's contributed by the trial site. So in general, CC ABHI does not seek to own any intellectual property from the products or projects that it funds. We don't That is not our aim, and we do not request that as part of receiving funding from us. When it's a partnership between you and a trial partner site, obviously that will be covered off in the contract that we ultimately sign at the end of the your successful application. And the general approach we've taken in the past is that your intellectual property remains your own, the trial partner's intellectual property, if any comes into it, remains their own, and any intellectual property that's created together, that the two parties agree is co-created, then we would negotiate that in the details of the contract as well. So that in principle, that's what we do. Obviously, in the nitty-gritty, we'll have to work it out in the language of the contract itself. And then finally, I mentioned the administrative fee. We had a question about how that was calculated. I think I've answered that in the body of the presentation itself. So essentially, it's calculated based on the total budget of the project itself. Okay, so now I'm going to turn some questions that we've gathered during the course of the presentation. Wouldn't the option to submit an application without an identified partner prejudice the application reviews in favor of applications that were brokered by the funding agency? No, that's right. So the answer is no. It doesn't bias us against you. I've given the basic description of what a legitimate trial partner site is. So as long as you're staying within those rules and having the at least one Canadian partner rule, we would simply evaluate it in the same way we would evaluate any of the presentations on the criteria that I discussed earlier. In the project team, okay, so we had a question about who should be included in the project team. Yes. So the question is, should we include internal and external members? So if you are applying as the commercial innovator, on the team members, should you include members who are not part of your organization? Yes. Just the focus should be on who's core to the project itself. So if you have third-party developers or a trial partner site who's going to be a key member on the project team, you should identify them in your list of team members. Healthcare organizations. So there's a question here about the four themes and their relation to dementia. So we do specifically mention dementia in the first three of the four themes. So there is a focus on dementia in each one of those, whether they be ER, avoidances, falls, and aging in place. We are specifically looking for projects that address the problems and needs of people with cognitive impairment. So I use that second term instead of dementia. The question here is, do all the projects have to relate to dementia? They should relate to the issues of the aging brain, and whether that be the normal aging brain or mild cognitive impairment or full-blown dementia or Alzheimer's. That can be true, that more broadly true, that we're dealing with those issues. It doesn't have to be exclusively dementia. And then cognitive fitness, it doesn't mention dementia at all. It just has to have a focus on improving and avoiding improving cognitive capacity and avoiding cognitive impairment in general for a broader audience. The matching funds must come from the industry partner. So when we say that we provide matching funds, they will be matched with the applicant, the industry partner, both cash and in kind, you should keep in mind, and also there is the ability to have additional funding from other parties. So actually, maybe I should take that one offline, but can that if the industry partner is providing a contribution and a third, then we'll match both of those? Is that the case? Okay, so we're just focusing on matching what the industry partner is providing, and up to $600,000, and it can be cash or in kind. So we have another question here about for a company that has both a for-profit aspect and a not-for-profit aspect of their organization. Um, Although they consider themselves one company, we suggest that the lead applicant be the for-profit arm of the company. Otherwise, you will not be eligible. And I think that's the end of our questions, unless we've received any additional ones. No, we're good. All right. So thanks very much for that. I hope I've answered your questions. If not, don't worry. Just reach out to me, and we can have a more in-depth conversation about it. I look forward to your email and your phone calls. I look forward to reading your applications, and I wish you best of luck in the forthcoming process. Thanks very much.